It's part of a bigger picture, and that's where the joy and the challenge and the continuous change really comes from. And what we do exceptionally well here at Flinders is work in what's called like an interdisciplinary team. You know how annoying it is when you have to go to a GP for something and then, you go to another health professional and go, you've got to go back to the GP to get a scan and then you've got to do something else. The more that we as health professionals can work as a team, it gives us our patients a much better experience, and it actually gives you much better job satisfaction as well, because it's much more fun working with people than it is in isolation. And it is something that we work really hard on at Flinders, and we actually do really well. So it's really important that you connect with each other as a discipline, like you are going to be physios, get to know each other, because those connections are really important, especially in Adelaide. Like, I can't say this interstate, but Adelaide is so small, and you'll get to your point in your career where I am now, where you're like, oh, that's right, that's that person I went to uni with, or that's right, that's that person that I met through this sports thing or wherever. And positive relationships and networks, and connections, are really important. So take the time to get to know each other now over these years. But also take that chance to get to know people in other disciplines, because it's so helpful when you understand what they're going through and what their job's like. It just makes you better all around yourself, and again, helps you to see things from a different perspective. And that's what's really good about these first 3 years of your degree, is how you're going to be able to get such a broad understanding. You'll get there in with your focus skills at the end, but, when I look back on my career and things, don't underestimate how important it is just to know a little bit about everything. And, you will surprise yourself in time about how much you actually draw on those things that, I didn't think I need to know that. But actually, it really well rounds you. So enjoy it and really take up that period of time there. And this is Kelly. Do you need a stretch? I can keep going. I don't know. You can take over.
No, you keep going for a minute.
Keep going for a minute? Oh, cool. So I've talked a bit about those things, and I guess you can see that in some of these words on the screen here. So we've set up a little bit of, for our Masters and our Bachelor curriculum, because it's all very connected, words and things that are really important to us. So this is stuff that we think we do, but also that that we hope to do, and the sorts of physios that we want you to be. So that idea of partnership is really important to us. Leadership is really important to us, and you might think, I'm not a leader, or I'm not a manager. Leadership to us is about how you go about your day-to-day things with the people around you. So leadership is today being brave and speaking to someone else or meeting someone in the room. It's about your circle of influence, which is the people next within the people you're coming across every day. So you can show what it is to be a leader in the way that you approach your studies, in the way that you approach your work. It's not a job, it's the attributes and things you have. You can see those sorts of things. As physio, obviously exercise, manual therapy is, kind of our core business. Behaviour change is really important, because if you can't actually communicate with your patients and help them in behaviour change, they're not going to go and do that exercise program. What's that light bulb joke? How many physios does it take to change a light bulb? One to give them the exercise program, and that's right, they don't do it because they don't tell them how or something. I probably should have looked up that before. I thought in my head, I'm like, there is a joke about. So, but the point is, you have to engage people, and if you and you can have great hands-on skills in theory, but that connection, and that's really important to us here as well. So is prevention, rehabilitation and maintenance. So physio is not just about fixing people when things are broken, it's about helping them on their active lifestyle. The way we approach that is by being interprofessional, evidence-based. We are a science-based profession. We're always looking at, what's the evidence for things, and it's important that we use research and evidence and patient values to drive what we do and drive our decision-making, and that's what makes you a professional, is your ability to judge those different things. So all the stuff you're doing in first year, while I know it's like research and study skills, it does progress, it does move up, and there are definite ways that it connects to your job in the end.
Kelly's got her breath now.
Yeah. This is probably great for you. Yeah. Physio is awesome. We haven't done any social yet, but Anyway, thank you for letting me be proxy and wing person.
Thank you for starting.
That's all right.
Do you think I haven't done anything social yet?
No, they haven't got to know each other yet.
Ah, okay. No, that will come. That's fine. All right. Thank you so much. Sorry for the handover, guys. So my name is Kelly Huxley. I'm the course coordinator for physiotherapy here at Flinders Uni. Basically, what my role entails is I'm responsible for educational quality within physio. So you have Jane Harford in the Bachelor of Health Science, but then I probably have a little bit of involvement as well in your undergrad degree, and then a lot more once you get to the master's stage. So that's why I'm here chatting today. So shall we talk about what physiotherapy is? Who has seen a physio before? Good. Okay. Now I want to ask lots of questions about the people who haven't seen a physio before but still decided they wanted to be one. So I'm going to guess, out of all those people who've seen a physio, I'm assuming it's like in a private practice sports kind of capacity. Yeah, okay. Does anyone know anyone or know anything about what physios do in hospitals? Show of hand. Oh, I've got one nod. 2, 3. Okay. It'll be fun when you get to placement. There's a lot of hospital work there as well. Or anyone who's seen what physios do with children, for example. Yeah. Okay. This is going to blow your mind, all the other things that physios do. So this might seem like a really generic definition, but physios work with people. I'm hoping that's a given. There are some out there who, like equine physios or vet physios, I don't actually know where they get qualified or where they do that. It's very rare. We will teach you to work with people, not with animals, to develop, maintain and restore basically essential movement and movement quality so that people can function and do what they need to do and what's important to them throughout the lifespan. Okay, so physios will work from, you know, tiny little babies all the way up to older adults. So I've got a few probably examples there. Physios involved in exercise, so there are exercise physiologists as well. Has anyone come across them before? Yeah, okay. So they specialise in exercise a little bit more, but physios certainly prescribe a lot of exercise and are involved with exercise programs. In the middle, it might be a little bit hard to tell, but the girl who's floating in the pool is actually an amputee. So hydrotherapy is something that physios can be involved in and provide as a service. So really extending that exercise capacity to an environment that may help people a little bit more than working on land. We can use the properties of water to help us. So that's sort of more of a rehab type focused situation there. And then here on the right-hand side, looking like treating somebody in hospital, maybe after an acute injury, trying to get them moving and back to being a bit more independent. So lots of different things that we do. We can work in lots of different settings. So my experience comes primarily from working in hospitals and rehab centres, particularly inpatient rehab, so where people are staying in hospital a bit longer term to rehabilitate after particularly stroke and brain injury and that sort of thing. I love doing that sort of stuff, so more than happy to talk about it if anyone's interested. But we work in acute hospitals as well, so people who have had surgery or are acutely unwell in ICU even. Then community settings, which is very broad. So this might be people coming into particular outpatient clinics or even doing some home visiting or mobile clinics as well. Aged care, definitely. Private practice, which kind of fits under community as well. So that's probably what most of us know physio as, those big chains like Physio Extra. Involvement with sports teams, so that can be at a local level or professional level. Research, I'm not sure if Claire talked about that. She's kind of our shining research star in the program, but physios can certainly be involved in researching, particularly relevant to our profession, and that influences our evidence-based care that we provide as clinicians. And then education as well, which is how I've ended up here. So lots of different opportunities to practice in physiotherapy, and in our program, we try and give you a really broad breadth of experiences so that you can get a taste of everything and work out perhaps where it is that you'd like to be once you graduate. All right, this bit's a little bit boring, but it's kind of important to know in Australia and New Zealand there are physiotherapy practice thresholds. So that's basically the minimum standard that you need to be able to demonstrate of your competence to practice as a physio to initially be registered, so to move from being a student to being a qualified physio, and then to continue to practice. And it covers these roles here, which I know are probably relatively vague for now, but there's lots of different roles that we play and competencies that we need to be able to demonstrate for you to graduate. So our program makes sure that we cover all of those things along the way so that we can be confident once you finish, we're sending you out well and truly prepared for the workforce and to continue to practice as a physio. All right, so Bachelor versus the Master's components. The Bachelor of Health Sciences is 3 years full-time or equivalent, and some of those topics in the Bachelor of Health Sciences are specific prerequisite topics for the Master of Physiotherapy, and then there are some others, well, most of them are basically going to develop your skills and knowledge that will be relevant for once you enter the Masters. And then the Master of Physiotherapy is 2 years full-time, so that's the bit where you become a physiotherapy student. Our program is accredited by the Australian Physiotherapy Council, so they basically say, yes, everything that you're teaching is relevant and required for these students to become a physio. And once you start the Masters, you'll officially be registered as a physiotherapy student with APRA, which is the Australian Health Practitioner Regulation Agency. Okay, I've got 5 slides of what you're going to study. I'm not going to go into it in a huge amount of detail, but as Claire said, there's a lot of foundational stuff that you'll cover, particularly in this first year, around a lot of sort of biology, human sciences, understanding the healthcare system, research and study skills, and in semester 2, introduction to physiotherapy. So in that topic, you'll meet Catherine Shepherd, who's one of our physiotherapy teaching team members. And that's just a nice introduction to sort of understand the scope of physiotherapy, relevant agencies that we work with, and scope of practice, and then we'll build on that later. In year 2, again, we're building on what you've learnt in first year. So first is kind of understanding the broader scope of things. Then we'll bring it into understanding maybe more social aspects of health and where we fit within that. Rather than more basic study skills, we're going to think a little bit more about how we look up evidence and make sure that what we are doing in practice is quality and aligns with the research and the literature out there. And then we get a little bit more involved in our understanding of the human body, in human physiology and exercise prescription and physiology. And then when you get to neuroscience for therapists, there's a really great topic coordinator called Kelly Huxley who manages that topic, which is one of my favourites. So that's where we start to learn a bit more about neuroscience, obviously, how the human nervous system works and how that influences things like sensation and movement, which are really important to what we do in practice. Then in third year, again, building on things a little bit more. In 3001, there you'll have Introduction to the Science of Physiotherapy. So that builds on that first year topic, and you start to look at some cases and a bit more detail about what sort of interventions do physios use and how does that apply to these cases. Some musculoskeletal anatomy, which is really important for your musculoskeletal topics in the Masters, and pain, posture and movement, which kind of ties a lot of that together to think about injury and pain and how we manage those, and that's coordinated by one of our physio teaching team in Jared Strawbridge. Okay, and then year 4. It seems like a long time now, doesn't it? When you enter the Masters, in the first year there's only 3 topics per semester, but one of them's a 9-unit topic. But this is where you start to learn your clinical skills. So musculoskeletal practice 1, where you basically look at the arms and the legs, and assessment and management of issues relating to those, and performance of movement and function, which is a really nice foundational topic to learn things like manual handling. So how do you put your hands on someone else and help them to move? How do you prescribe gait aids, which are things like crutches and sticks and frames? And then we look at orthopaedic patients, so any surgery involving knees, hips, shoulders, things like ACLs, those sorts of things. So really foundational, and you start with a 1-week placement in that topic. Interprofessional practice, where you'll work with students from other disciplines as well. And then in second semester, cardiorespiratory practice. So this is where you will well and truly learn what physios do in hospitals. Musculoskeletal practice, focusing more on the spine. So the first one looks at arms and legs, and the second one will look at the spine a bit more. And physioclinical practice, which is just kind of bringing a lot of things together. And then there's a 5-week placement in that one as well. And then final year, the early practice 1 and 2 and integrated practice 1 and 2 are all placements. So there's 20 weeks of full-time placement in that final year. Do neurological rehab, which is where I've run from this morning to come up, your neuroclinical skills, and then some other topics which kind of run alongside your placements to understand really specifically, I suppose, our roles in health systems and prepare you for work as a professional physiotherapist, and then some more complex cases and a research project as well. Does anyone have any questions about those? That was 5 years in a nutshell. Okay. Don't worry if you forget this. I'll remind you when you enter the Masters. But good to know, when you're in the Bachelor of Health Sciences, you use normal university semester dates. Once you get to the Masters, we like to be different, so we don't use conventional semester dates. But that also is because we need to use a bit more of the year to be able to fit in placements and everything as well. Please don't freak out. It doesn't mean that you have to be doing stuff all of this time. These yellow blocks for placement, you'd be doing 2 out of the 4. So you will have some time to rest in between, but it is a pretty busy year, particularly your second year in the Masters or your 5th year overall. I think that's all the detail I'll go into for now. So in terms of communication, I'm not sure if you've had this reiterated already, but if you need to get in contact with us, if it's about a topic, please jump on Flow and use the discussion board for that topic. Or if it's something of a bit more of a personal nature, please send an email to your topic coordinator directly. If it's more to do generally with your ability to study or your progress through the degree, if it's in your first 3 years and to do with the Bachelor of Health Sciences, you can contact Jane Harford, and once you get to the Masters, your primary contact for that will be me. So just a couple of things to highlight, some things to look forward to once you reach the Masters. Look at how happy all these people look. Physio must be so rewarding. This is me pretending to be a patient lying down here. So we do a lot of simulated learning, which is what's pictured in these 2 diagonally. So all of your teachers will dress up and pretend to be patients and then make you treat them. But it's a really good opportunity for you to practice the skills that you've learnt in class before you go out on placement. So it's kind of a safe space to experiment a little bit, maybe make some mistakes. You get to time out, you get to rewind what you're doing, you get to try again. But that's a really great part of our program. Have you guys heard of the Health to Go clinic yet? Yep, beautiful, on site. If you would like to go and see some physiotherapy students, they're down there pretty much all year round. So that's a placement that we offer as part of the program, but it's also available to you as students as well. So heavily discounted physiotherapy assessments and consults down there. Interprofessional practice, so we do have those opportunities to work with other disciplines as well. We have a really strong focus on rural and remote health. So we understand that there are a lot of complexities to rural health provision and a lot of gaps in rural healthcare as well. So we provide a lot of placements out in rural and remote areas, which I think are great opportunities for us to contribute to the healthcare system, but also really great opportunities for you guys to learn how to be very flexible and adaptable clinicians as well. So I've been out to visit a few of these sites, and it's even tested, I think, my practice and my approach to healthcare as well. And I've learnt a lot even from visiting, let alone what you guys would learn in a 5-week placement. We also have a peer mentoring program, so our first year and second year students can volunteer to be involved in this, and basically they're paired, first year with the second year, so they can catch up. The second years can share their wisdom and the first years can benefit from that and ask lots of questions. And then we have peer learning opportunities as well. So as much as the teaching staff will dress up as patients as well, later in the year we also have our final year students come in as simulated patients. So as a final year student, you get an opportunity to contribute to the education of the first year students too. We have lots of connections with the physiotherapy profession out in industry. So we work really closely with them to understand what the pressures are out in industry and what we should be focusing on teaching the students here, so that will be relevant for when they get out into practice as graduates, and work really closely with them for placements as well. All of our staff have a really broad range of physiotherapy experience and skills. Majority of our staff are still working as physiotherapy clinicians, so you really benefit from that up-to-date practice knowledge. And then we have some of our staff who are actively involved in research as well, so you kind of get to benefit from both. And obviously we have some fairly diverse placement experiences. FUPSA, I don't have a representative from FUPSA here to talk today, but this is the Flinders University Physiotherapy Student Association. You're welcome to get involved with them as an undergraduate as well. It's run by students here at the university completely voluntarily. They organise a lot of student advocacy, but I'll be honest, mostly social events. So, see, look at that. Look how much fun they're having. Once you get to the masters as well, they've organised some sort of additional extracurricular courses and things like that, so taping, other additional skills that they might develop and learn alongside what they're doing at university, so relating to things like being a sports trainer while you're studying and those sorts of things. If anyone is interested, you're more than welcome to grab your phone out now and scan the QR codes if you would like to join them. The Facebook page, they'll pop up lots of job opportunities for things like working as a sports trainer, and once you reach the masters, there will be opportunities to buy secondhand textbooks, secondhand uniforms and things like that. And I'll make these slides available to you as well, so if you change your mind later, you'll still be able to access the QR codes. And their AGM is happening next week online, so you can join them, and then you can also register for the AGM if you want to as well. All right, I think that's it. I'll give you the other QR code in a minute, but did anyone have any questions at this point? No. I feel like some people look scared in the room. Are we feeling good about study that's coming up? Cool. All right. If you think of anything along the way that relates more to the physio side of things rather than the Bachelor of Health Sciences, more than welcome to shoot me an email. Otherwise, I will see you in Year 2 in Neuroscience for Therapists. I'll pop this QR code up if you can scan that and complete the survey about your orientation session today. If you do complete it, you go in the prize for go in the draw for a $250 voucher prize, and the details of what you have to enter are up there. So feel free to do that. Once you're done, you're more than welcome to go. I know this finishes much earlier than you're probably intending. Feel free to explore campus a little bit. I'll hang around for a little while if you do have any other questions. Otherwise, really nice to meet you, and I'll get to know a few of you a bit more next year. All right? Thank you very much, guys.